Welcome to my channel. I'm Pauline for Tragedy and Beauty. Today I'm going to talk to you a little bit about hands-on healing and empathy. When I came into work one evening, about 7, a little after 7, got a report from the off-going nurse. I was told, about my patient, all the things that he required, what kind of surgery he had, etc., etc., and the meds coming up, what was due, what was last given. And these are requirements in order to get a shift report. And it's a one-on-one. So once she had given me everything she needed to and left, I decided to listen to all the people going by me because there was a lot of doctors and nurses and some tears were falling from the doctors. So I was quite concerned as to what was happening a few doors down from where I was. As I decided to listen a little bit more, I got the feeling that something wasn't right. Like, I can't explain it, but it wasn't right. So I thought, let's get my work done first and see my patient, and then I'll kind of drop in and see what the next nurse is doing if she needs help, which is often what we did if someone required some help. So I saw my patient, did everything I was required to do for that hour, and they were very stable, not a problem. So after about almost an hour, I guess 40, 50 minutes had gone by, and I thought, okay, this is perfect timing before my next set of checks. So I explained I'll be right back, and I went down to the next door. And I began talking to this nurse and asking what had happened, like what's wrong. And she said, well, it's a young fella, just like 11, and he was in a fire that they had started in his basement, and he tried to put it out, and he caught his pants on fire, and when he did, he burnt 80%, third degree, of his body. And I was like, wow, that's critical. And especially because they're not big, and so they have no reserve. They're so young. So I said, Debbie, do you want to take off and go to break? And she said, no. I'm fine right here all evening. And I said, no, I need to see the boy. And I said, I need to see if I could do hands-on healing with him. And she looked and said, no, you don't get to do that until you go see the parents. And she said, you explain it to them and let them say yes or no. So I thought, okay, I can do that. So they were in the waiting room for the family, and I went out, explained who I was, and I explained to the family what it is that I actually can offer. And I said I did not realize the doctors gave him approximately another half hour to live. I did not know that at the time. However, I gave my blurb to the family and explained what hands-on healing was. And I said, if there's any way at all, I will do what I do, hands-on healing, without touching him. And after which, half an hour after that, I will draw some blood work to see if his blood is returning to somewhat improvement versus worse improvement. And I said, by that, I can then know if I can proceed through the evening to do this, or if I can drop some of the drugs that are high-dose drugs to keep you alive. If I can start dropping it back a bit to allow him some leeway. And the mom and dad both said yes, that I could do that. So I said, I'm going to let the other nurse know. So I went in and let the other nurse know that they agreed. They're sitting out there and they're crying, but I said they agreed that I could do this for them. And I said, I'm really not sure if it's going to work, but really with burns, it's supposed to work really well. So anyway, Nurse X said, okay, you go ahead and I'll go get a coffee and I'll come right back. So I said, could I please have like 15 minutes and then I'll know what I'm doing? So I'll see how he does. So she left to get a coffee. I closed the door and I began. And I began, by grounding myself and continuing on. And after 15 minutes was up, I looked at the monitor, and his heart rate had dropped down into a subnormal range. His blood pressure seemed to improve just a little bit. And I thought, okay. So I said, child, whatever his name was, let's call him Brad. So I said, okay, Brad, I'm going to leave, but I'm coming back to see you in 2 hours. Okay? And then the nurse came back in again, and I left and went to my own patient. And half an hour later, I did come back and draw bloods from the tube and sent them off to the lab. When those bloods came back, I was quite excited to see that his oxygen level was up over what it had been. So I decided, okay, he's accepting this. This body's working with me. So I left, went back to job, and in another hour, an hour and a half, I went back, did hands-on therapy again. At this point, I watched the monitor as I did it, and his heart rate was coming back, his blood pressure was improving, and I said, I'm going to drop one of his drugs actually. I said, I'm going to drop the heaviest drug down just a little bit to see if he can support that. The nurse was kind of reluctant, but she said, okay, if you think you can do it. So I thought, I can do it. The body's telling me I can do this. So I did. I dropped it down 1%, not very much, but I did do it. And I came back a few hours after that, and blood pressure's holding, a little improved again, and heart rate's coming down. So I did it again. This time it was a 3-hour span between the last time I had done hands-on therapy and the next time. So at this point I waited half an hour, redrew his bloods again, and sure enough, what I expected had happened. His blood pressure was normalizing, and his heart rate was starting to normalize. So I decided that, okay, we can take the drugs back down a bit. So I worked on the next drug a little. It's like a very small amount. And the body accepted that. This went on all night, where I would come back every 3 hours, do hands-on therapy all over his body, and then draw the blood works half an hour after that, allowing it to rest. Come morning, it was amazing that we had gotten half of the heavy drugs off. And at this point, when the doctors came rolling in, I was able to let them know that this is what I found. They were quite excited, actually, to find out that by the grace of God, something had happened. And it wasn't anything different, because by now I've dropped the medication down to almost down to its by about a quarter of what he was on. And I was really excited about that. And I asked the charge nurse, could she please pick somebody with a positive attitude for this kid, and somebody who would be able to follow me with hands-on therapy. That meant that I'd stay behind, teach whoever was taking the child, and continue with a positive attitude. So she agreed. She said, if that's what you think it's going to take. I said, it is. Trust me, it is. I could just feel it. So I did. When the nurse came on, I said, I kind of picked the two that I needed, because I knew they were the most positive nurses out of the whole bunch. And I just said, look, this is what it is, and can I teach you something really quick, and can you follow me? And they said, well, we'll try. And I don't know how many times I can get it in. And I said, I know you're going to do dressing changes, but what I need to know is, does his blood pressure and heart rate and his output and things like that we need, the critical items, do they begin to stabilize? I said, secondly, when you do the dressing, can you look and see how much drainage is on that dressing? Does it look like there's pink underneath that in the tissue? So they had done their job until I come in for the evening and said, well, we were quite surprised actually as to what could happen with that. That's really interesting. I said, yeah, it is, isn't it? So lo and behold, when the next nurse came on nights for the 12-hour shift, I showed her, but I said, I will do it myself because I'm here. And when you do the dressing, I would love to see what the skin looks like. So meanwhile, a couple of the docs had came by at supper time, well, more like 8 p.m., and they were asking, like, so do you think he's doing any better? And I thought, oh, yes, he's definitely doing a little better. And so I asked them, what do you think? How do you feel he's doing? Now, mind you, this boy had, I'd say, a good 12 doctors with burn specialists and everything there. Everybody was at his bedside. And they couldn't believe, first of all, that the drugs had come down through the night shift. And secondly, his skin actually, and sloth we call it, actually started to look pretty good. So when I asked the first doctor that I know very well, I said, what do you think? Really, what do you think is going to happen? Well, she said I wouldn't give it any faith because she said he's going to lose half his face, his ears, his arms, and most of his legs. And she said that's even if he survives. And I thought, geez, thanks a lot, bud. But I thought, okay, I'll take that. The next doctor that I asked that came by, a burn specialist, he said, well, I don't know. I think we might have made a mistake on how much is burnt. Well, there wasn't any mistake about it. He was definitely at his 80%. However, I just charted, because apparently now that we have that ability to do that, we charted about hands-on therapy so that I could always relate back to it. Anyway, the long and short is going through the weeks with him. I did need coverage for 3 days off, and I did ask, could you please, see that this person and this person have that care, and hopefully this child will begin to rally. The parents were quite excited at this point to find out that he didn't die in the first few hours that they thought. However, he was doing better, and at the end of my shift, we were able to get one heavy drug off and began the next one. So when I came back after 3 days, he stayed about the same, but did begin to increase his heart rate. And that, of course, was my concern, was that if you don't have the proper training and you can't move blood the way I did, then I'm going to have to do the catch-up thing. So the first day I was there actually, I started doing it again, and sure enough, he responded beautifully. The second day was beautiful. The third night, we were able to get most of the second and third drug off. We didn't need to support his pressure. We didn't need to support the heart rate. And at this point, the ventilation that he was on, we could begin to wean him. So the next thing I know is they're beginning to say, well, maybe he's only 70. Well, then the next week it was maybe he was only 60. And this went on and on and on. And finally, I said to the family, the mom and dad, would you like to see what it is that I do now that, he's improving so much, and we'll be taking the breathing tube out soon? And they said, yeah, like we were wondering, what is it you're doing? So I brought them in, sat them quietly on either side of the bed, and I showed them. And when I did, they were like, is that all you do? I said, that's what I do. That's the training I've had for this. And I said, I'm not the only one that uses it in the building. One of the anesthesists use it quite faithfully before a patient goes under surgery, because he doesn't want anything to happen to their blood volume, and he's always maintained his patients very well while he's doing this therapy. So anyway, lo and behold, it took probably 14 weeks. We were able to get him off the ventilator. He kept his arms, he kept his legs, and he kept his ears. The skin tissue had pinked up. It had wonderful blood flow, and he was able to keep it. Eventually, he went to pediatrics, off of all drugs, all ventilation. He was actually talking and drinking and eating. And he was starting to mobilize on his own. And this was on the third month that we moved into pediatrics. He was discharged from us, and it was about 3 or 4 months after that that I had him come to the unit to see if I was working. And I got the biggest hug from his dad and him, and he was like, I remember your face, but I don't know what you did, but Mom and Dad said thank you. And I was like, I am so glad for you. Like, you're one lucky little kid. And he was back at that point playing baseball, of all things. And he was able to keep his ears, his fingers, his feet. He only had to have skin grafts at the very end. And even those weren't big skin grafts. They were smaller, more to his face, so he would have a normal growth after that. So if you've ever had somebody that is like that, you may want to consider finding somebody, especially if you're in the medical profession. You might want to find somebody that does hands-on healing and teaches it. It's one of the most opportune things you can do. But I have found other things with it. He wasn't the only person I worked with. I've worked with a lot of post-trauma people that have come in with trauma and something's gone wrong, they can't find it. And I've asked, some of them were my people. And I could find places that were actually capsulized with big tumors inside the body and required surgery. And it was up to the surgeons to do the follow-through for that. But a lot of them were quite shocked that it was found. Now, one gentleman in his 60s had one problem, but he ended up with several. And the one that I found that was still a leftover actually had to be removed. And it was a large abscess in the abdomen. And I said, I feel heat, which is what you do feel with hands-on therapy. You'll feel the cold or you'll feel some heat. And the heat's being an inflammation in the body. So anyway, they did decide to take him through x-ray again, did the CAT scan, and sure enough, behind the organ was another abscess that it didn't pick up in any x-rays. It looked like he was normal. However, they did take him back to surgery, took the abscess, and lo and behold, the gentleman actually, after that, began to heal and was able to come off his life support. I had another gentleman that was in a motor vehicle accident, and for some reason he complained of pain in his left arm all that time and was just crying, unbelievable. And he was on life support for a little while, but every time we touched his left arm, he would wince and the tears would come down his face. So I went over and I thought, let me see what I can find. There's got to be something for sure. So I went over and I felt his arm all the way through to see if I could find anything, both arms, abdomen, legs. And I went back to the arm that I thought was a little warm, and I said, I would re-x-ray that arm. And it was his left, and they did re-x-ray it and move it into quite different positions. And sure enough, there sat a full-fledged fracture, which then he had to have work done on that in the OR. And after that, he was perfectly fine. So it does help with the hands-on therapy. I've used it with cancer patients who don't get any help post-op, or they do, but the pain is so excruciating. And I understand that. So what I had done was done some hands-on with them, and relief. Now, relief was only like 2 or 4 hours, but still, they were able to sleep through that. The other person I did it with was when I went to our sister unit, medical intensive. And medical is usually, COPDers, chest pain, diabetics, things like that. But this gentleman, I'm not sure, I think he came in with COPD. So a lot of times when we take a break, we just roam up to the other unit, see how everybody's doing, say hi to your friends, and come on back again. But while I was up there, there was a gentleman that was screaming and yelling and trying to climb out of bed. And I said, "What's wrong with Buddy?" And they said, "Oh, he's been like that since I come in." Well, this was 10:30 in the evening. They come in at 7. So I thought, I just go down and see him. So I just went down and I did hands-on with him over his head. And I bet you it wasn't 3 minutes. He fell asleep. And they could actually turn him and everything through the night. And the men slept so well. So when I went up around 4 in the morning, they said, "What did you do to him? Did you give him anything?" And I said, "No, I don't have anything to give him." I said, "You saw what I did." I said, "Just that little bit of hands-on." And whatever it was just enough to relax him. So I'm not sure what the cause of the anxiety was, but I'll tell you, once he slept all night, they were amazed. And after that, it was like, "Could you come see so-and-so? Could you come see so-and-so?" And I was like, "Sure." And sometimes it wasn't anything but just the need to calm the nerves. I think a lot of it. But as far as finding healing points, points of injuries, that was so easy to do. So if there is somewhere that you can actually find someone that teaches it, or you want to do it for your loved ones, it's not expensive. It doesn't take long to learn. You just have to remember that it's not you that's doing it. God gave you the ability to do it with your hands. And you have to be grounded like a tree. And you do have to be grounded. And then it all works. So if you like the video, subscribe and hit the like button. And I'll see you on the next one. Bye.